Okay, guys, have a bonus one for tonight for you. D is a bonus show. The title, The House That Holds Us, Aging, Home Care, and the Quiet Geography of Decline. Aging rarely arrives as a single event. It comes gradually, like the slow setting of a house over decades, shifting weight, softening edges, revealing cracks that were once visible. For many older adults, the home becomes both a sanctuary and a challenge, a place filled with memory, yet increasingly difficult to navigate. And into this intimate landscape steps the home healthcare nurse, a clinician who sees what no hospital chart or clinic visit ever fully captures: the truth of how people age. Aging is not simply a biological process, it's a social, emotional, and environmental experience shaped by the accumulation of a lifetime's circumstances. Home care, nursing, more than any other discipline, makes these truths visible. The first signs. It often begins with something small: a missed medication refill, a fall that wasn't serious, a mother who once cooked elaborate Sunday dinners, now microwaving frozen meals, a father who used to drive everywhere, suddenly avoiding the car at night. Families notice these shifts, but they hesitate. Pride, fear, and love intertwine. The older adult insists they are fine. The adult child worries, but but does not want to intrude. And then the day someone says, maybe we should get a little help. Now, folks, before I finish this uh, presentation, I'm going to put this little part in this section. Okay? People have to accept help. When help shows up, some people don't want to accept help right away. Acceptance has to come gradually. Acceptance of a help of a person, a home health aide outside of the home, somebody that's coming into you, they have to accept the person that they're coming to take care of, and they have to respect the person's wishes. The person that they are coming to help has a home already set up, in an apartment building, things of that nature. So the aide The aide that comes to help them has to accept the way things are in their house. And they are the person that is accepting help. They are the aide's boss. They are in charge of what happens in their house. They are the one that the old saying is the buck stops here. Okay? The buck stops with the person whose house it is. The aide has no say so in what happens. So the aide has to accept who they come and help. That is the moment a home care nurse enters the story, not as a recruiter, but as a witness, as a guide. Inside the home, the story changes. Clinics see symptoms, hospitals see crises, home care nurses see contexts. They see the refrigerator with only condiments and expired yogurt. They see the pill bottles scattered across the kitchen table. Some empty, some duplicated. They see the spouse who is trying, truly trying, but is exhausted. They see the stairs that have become mountains. They see the loneliness that no vital sign captures. A home care nurse learns quickly that aging is not just about disease, it is about the environment in which disease unfolds. It is about the social detriments, economic stability, neighborhood conditions, health, literacy, social isolation, and access to care. That shape the trajectory of aging long before the first home care visit. In the home, these detriments are not theoretical. They are visible, tangible, and often heartbreaking. The work of witnessing home care nursing is clinical, yes. Wound care, medication management, chronic disease monitoring, but it is also profoundly relational. A nurse might spend the morning teaching a man with heart failure how to weigh himself daily, then spend the afternoon listening to A widow talk about the husband she lost last winter. They might rearrange furniture to prevent falls. Call a daughter to explain a new medication, or sit quietly with someone who is afraid of what tomorrow might bring. They become the person who notices when depression is creeping in, the person who catches cognitive decline early, the person who sees the bruises that suggest a fall no one mentioned, the person who recognizes when a caregiver is burnout. Home care nurses do not just treat conditions, they tend to lives, the bridge between independence and safety. Aging at home is deeply human. Aging at home is a deeply human desire, a familiar creak of the floorboards, the photos on the mantle, the garden outside, the window. These are anchors, but staying home requires support, and that support must adapt as needs evolve. Home care nurses become the bridge between independence and safety. They help older adults maintain dignity while acknowledging vulnerability. They help families navigate guilt, grief, hope. They help systems understand that aging is not a problem to solve, but a journey to accompany. They also confront inequity daily. The patient who cannot afford medications, the home without heart or heat, the rural road. That delays care, the caregiver who works two jobs, the older adult who has no one at all. These inequities shape outcomes more powerfully than any single diagnosis. Home care nurses know this because they see it, the tenderness of the work. These are there there is a moment in many home care journeys when the nurse becomes more than a clinician. They become a companion in the final chapters. They may be the one who notices that a patient is sleeping more, eating less, withdrawing. They may be the one who gently suggests that it's time to talk about comfort, not cure. They may be the one who sits at the bedside holding a hand, listening to stories that have never been told. Aging is not only decline, it is memory, legacy, and meaning. Home care nurses help people live those final years with as much grace as possible. Aging seen clearly. Aging is not a failure. It is not a burden. It is not a problem to fix. It is natural, universal, deeply human process. And home care nursing is one of the most intimate, powerful ways we honor it. Home care nurses step into homes with humanity and skill. They navigate inequities, advocate fiercely, and witness the full truth of a person's life. They help older adults remain rooted in the pieces or the places they love, surrounded by the memories that shaped them. Aging is a story. Home care nursing ensures it is said with dignity. Okay, guys, that is your shows for tonight. I will see everybody tomorrow for shows. Until then, greater wellness. Take care, folks. You just saw the end of it.